Welcome back. Over time, age and events like pregnancy and childbirth can affect the internal and external structure of the vagina, causing it to change in its appearance. Dr. Mona Hardas Kiran is here with us to explain cosmetic gynecology and how it helps women. Thank you so much for being with us.
Thank you for
So
inviting
just
me.
in summary, what is this type of cosmetic gynecology?
Cosmetic gynecology includes a lot of different areas. Obviously, as a gynecologist, we take care of vagina, vulva, clitoris, all that area is encompassing. And there are conditions where people are not happy with the appearance. It could be aesthetic or it could be functional. They might have problems with friction or the area being too large and it's protruding out of the clothes, not making it look good, inserting a tampon. Sometimes the sex can be painful. There are so many conditions which are there which are a part of the vagina and vulva, and nobody talks about it. So as a cosmetic gynecologist, we try to take care of it, help the patient with an aesthetic appearance as well as the functional.
So what are some of the ways that you can change the appearance?
Well, a lot of ways. If there is an extra growth, or we call hypertrophy of the vagina or vulva, it can be reduced surgically or non-surgically. If there is too much of a tightening or a narrowing, it can be extended. It can be made bigger. A lot of women, the way I started it, a lot of women had actually had surgeries which were mutilating surgeries, and as a part of their culture, and the vagina was very, very small and tight, and they could not even have sex. And that's how I started this, making it bigger so they can have a functional capacity in the vagina. So.
Now, is this like, I don't want to say regular, but the plastic cosmetic type surgery, will insurance cover this if it's medically necessary, or is this strictly just because you want to?
It is not covered by insurance, unfortunately.
Okay.
Yeah.
So how have you seen, or what is the healing process like?
Depends. As I said, there are surgical and non-surgical procedures.
Okay.
So if it's a non-surgical procedure like a radio frequency waves or laser or something like a PRP or platelet-rich plasma, we use it for injection. There's really no downtime for it.
Okay.
But if it's a surgical procedure, then it will be 4 to 6 weeks of healing.
Okay. And what do people need to know, I guess, before they come to you to say, this might be something I'm interested in?
Well, first of all, I want to tell people that everybody is different, everybody's body parts are different, everyone's shape sizes are different. So if there is something unusual about your appearance, it might be a normal part, but if it is bothering you, if that's causing problem functionally, or you don't like the look of it, it can be fixed. And there are people who are trained. Now, cosmetic gynecologists, we do extra training after our gynecology training to learn about the plastic part of it. So there are trained people. So if whichever area you are in, seek somebody who has got an extra training.
Yeah, it's always good to have the best person possible performing that. Have you found in any of your patients that maybe some women have conditions that they didn't realize was something that was fixable?
Yes, there are people who would not even complain, because I'm a gynecologist. It's like, say, during my annual checkup examination, if I see something, I usually start a conversation saying, do you have pain during sex? Is it bothering you? And then the patient open up, because a lot of times they're scared. They are worried about it. They are embarrassed sometimes, like, oh my God, am I the only one? But no, you're not. There are so many out there.
Yeah.
So start the conversation. It doesn't hurt asking.
No, it doesn't. And if pain is an issue for a woman, especially during intercourse, what is the difference between needing to come talk to a doctor about it versus something that maybe she can do at home?
Well, if pain and discomfort is because of, say, vaginal dryness, there are so many things over the counter, like there are lubricants which could be water-based or silicone-based. You can try that. Natural oils, you can try those. And if that is not helping, then I really would want her to see a gynecologist to see what's the cause of pain. Is it the atrophy? Is it because of perimenopause, menopause, or is it because of decreased hormones, like you're breastfeeding and you have decreased estrogen, and that causes vaginal dryness and pain during sex? You could be on a chemotherapy for certain cancer treatment, that could be the causing it. But there are things which can be done. I mean, as I said, over the counter lubricants is one, obviously, but hormones is another. But if you are not interested in hormones, or if you don't want to take any, there are devices, there are energy devices like laser and radio frequency out there. We use the platelet rich plasma, it's called OSHAT, which is out there. So there are so many things which can be done to help out.
Gosh, that sounds awesome. Thank you so much, Dr. Kiran, for joining us with that valuable information.